Hello and welcome to yet another episode of Dr. Sin. Today we have with us Dr. Anil Saxena, who is a nephrologist from Al Zahra Hospital, Dubai. Let's welcome him to the program. Welcome, doctor. First of all, we would like to know more about you.
I am a consultant nephrologist. I am also a director of dialysis services in Al Zahra Hospital. I established this state-of-the-art dialysis unit in this hospital, which has got all the facilities comparable, matching to any dialysis in the world. And it is becoming very popular these days now. This is emerging now.
Okay. So now coming on to the topic. So why are kidneys so important?
The kidneys are basically filters. But apart from being filters, they have multitude of functions, a lot of functions. First, talking about the filters, whatever we drink, we eat, this is converted into toxic products. The toxins are metabolized in the liver, and then this filters through the kidney. So if the toxins are accumulating in the blood, they will affect kidneys.
Okay.
The second thing is filter function. So if there are too much of cholesterol, if the blood is too thick, like in diabetics, or there are crystals like calcium too much, or patient is dehydrated, then this filter may get choked and can cause acute renal failure. So this is filter function, but the kidneys are also important to keep your electrolyte balance, like calcium, phosphorus, magnesium, and other things. They are also important to maintain your blood pressure. They are also important to synthesize vitamin D.
Okay.
So if the kidney fails, people are usually vitamin deficient. Also, kidneys produce erythropoietin, which helps in building the hemoglobin. So if the kidney fail, the patients become anemic.
Okay.
So all these things together, if the kidneys fail, whether it is acute or chronic, make the patient very sick.
Okay. So now, what causes kidney failure?
There are a lot of causes actually, but the most important cause is diabetes and blood pressure. And nowadays we call this a metabolic syndrome. Diabetes, blood pressure, hypercholesterolemia, and apart from that, there is dehydration in the climate like this in tropical countries. People do not drink enough water. This can cause. This is the most common cause for acute and chronic kidney diseases. So 40% of the patients, those who are having kidney problem, they are diabetics.
Okay.
At the same time, they may also have blood pressure because of either kidney reasons or different reasons.
So the symptoms of kidney failures are diabetes?
So the symptoms of kidney failure are like when the kidneys fail, people get, because the toxins accumulate, because the kidneys are the filters and they do not filter, so urine output may drop. Other things may happen like when the urine output drops, and the urine is the one which excretes the toxic products, the toxins accumulate in the blood. So, and they affect all the organ systems, including brain. So it could, starting from above, patient may feel very weak. Maybe there would sometimes confusion, convulsions, coma sometimes, which is called as uremic encephalopathy. There could be visual disturbances. There could be kind of generalized weakness, nausea, vomiting, and loss of appetite. There could be skin changes, like there may be sometimes skin allergies, or there could be itching too much, called as uremic pruritus. And there could be so many things. And maybe sometimes when the potassium becomes high and the phosphorus also becomes high, the potassium may cause, high potassium may cause cardiac arrhythmias, which can cause severe palpitation and sometimes heart block. So this can kill the patient. When the functions of the kidney are impaired, accumulation of toxin occurs. And these toxins make the patients very sick. So sick that the patient may need cleaning of blood to support the kidneys till the kidneys recover. So if kidney disease is such where the patient's kidney disease is such that where the kidneys could recover after some time, it is called as acute kidney failure.
Okay.
When the kidneys do not recover, then it is called a chronic kidney failure. So chronic kidney failure usually requires dialysis. But acute kidney failure may sometimes be treated conservatively, but in very severe cases, they also need dialysis.
So now what are the 5 stages of chronic kidney disease?
Yeah, the 5 stages are like they have been made on the basis of glomerular filtration rate. As I told you, kidneys are filters, so filter function takes priority to the front seat. So in the stage 1 and 2, the glomerular filtration rate is normal. Normal glomerular filtration rate is around 100. So problem starts with the stage 3, where the 50% of the kidney function is lost. And that through a stage 4 progresses to stage 5, which is end-stage renal disease, when the glomerular function GFR is reduced to less than 15 ml per minute. So that is end-stage renal disease, and then the patient needs dialysis. And the dialysis is required in such a stage is 3 times a week. That is about 12 sessions a month.
Okay. So what are the tests done to assess kidney failures?
There are so many tests, like all the metabolites which are accumulated in the blood. We just know about the urea, creatinine levels we have to see. They keep on rising because the potassium and phosphorus also excreted through kidneys, they also rise. So we do the urea, creatinine, sodium, potassium, calcium, phosphorus, these levels in the blood. And also examine the urine for any acute conditions, like there may be some crystals, there may be some cast, which may indicate that there is some other pathology for that. Not so, and according to the causes, there may be other causes like autoimmune diseases sometimes and drugs. So we have to review the various drug protocols of the patients, and whether the patient is having any other underlying problem or medications, like such things. So as we get the clue, we have to investigate that way. But the basically diagnosis established by doing urea, creatinine, sodium, potassium, calcium, and phosphorus, and sometimes uric acid and the urine examination.
Okay. So what is the advice that you usually give to the patients?
Yeah, the advice is actually, because the main causes of the renal failure are the diabetes and hypertension. So blood pressure must always be controlled. And the diabetes also should be under control. And diabetes progress should be measured by HbA1c, which should be less than 7%.
Okay.
So if the diabetes is controlled, blood pressure should be 130 by 70 or below, not above that. So it should be treated in such a manner. Plus the adequate amount of water should be taken. Like patient needs, for routine, an average person requires to make about 1.5 to 1.8 liters of urine. So to make that much of urine, you must drink about 2.5 to 3 liters of water. But we live in air-conditioned houses and offices and everywhere. So people are not drinking that much of water. So there is a relative dehydration in everybody. And the little bit of thirst is quenched by some kind of cola drinks or kind of things, which are also not good for the kidneys.
Yeah, okay.
So carbonated drinks are also not good. So I think as far as possible, one should avoid carbonated drinks. Water means water. They should take at least 3 liters of water a day. And other drinks are not included in this. And protein consumption should be kept to minimum. Minimum means it should not be, all the food should not be composed of protein only. There should be a balanced diet. Fruits and vegetables and the things which contain more water and minerals and vitamins should be taken. More dietary fiber is to be recommended. Like they should not take more juices. If you have to eat orange, you should eat orange as such.
Yes. Okay.
Not 8 oranges juice, which will also put a load on your insulin. Body will have to produce more insulin for that. So you'll be spending much more insulin and you will be depleting your insulin for longer period. So earlier you'll be diabetic.
Yeah, okay. So how long will the patients have to be hospitalized for the treatment?
Initially, it depends on the patient condition. If the patient is very sick, we stabilize the patient by admitting the patient to the hospital. But if the patient is walking in and he's stable, otherwise we just give appointment for because hemodialysis is done through a vascular access. So we have to take the blood into the machine and clean it and then send the patient back to the blood back to the patient. So what happens? So we need an access. So either we should have an AV fistula, which is called as arteriovenous fistula, or a graft, or we put a direct permanent catheter in the neck veins, which is temporarily used, can be used up to 3 months till we make the AV fistula. This is for the chronic patients. So once we have the access, we can send clean the blood and send the patient into the patient's body, and do this for 3 times a week. In acute cases, it can be done for a few sessions till the patient starts producing urine and the urea creatinine start falling. Then the patient recovers completely.
Okay.
Yeah.
So doctor, that was nice talking to you. Thanks a lot for being a part of our program. So that was Dr. Anil K. Saxena with us. Until we meet next time, this is me, Anna, signing off. Take care.